And at this stage, really difficult to not repeat a number of things that have been said. And let's also remind this afternoon, it's not just a royal wedding, and later this afternoon, an important football match. It's also a beautiful Saturday afternoon. So I think we should read the fact that there's such a high turnout for this meeting as an expression of our shared commitment and our shared sense of urgency. So I think in that way, you've already achieved your goal. From the Global Fund, we totally recognize the importance of better strengthening the linkages between HIV and HPV programs. We now have the potential to reach more women for the prevention, screening and treatment of cervical cancer through integrated sexual reproductive health services and HIV programming and investing in building resilient and sustainable systems for health. The time to act is now. Cervical cancer is one of the 3 age-defining cancers and the second most common cancer in women worldwide. And just to repeat some of the statistics that Michel Sidibé already mentioned, women with HIV are 5 times more likely to develop cervical cancer. And following HPV infection, women have more than double the risk of HIV acquisition. And we also know that cervical cancer in women with HIV occurs at much younger ages, sometimes even in the early 20s, and develops much more aggressively to invasive cancers. And as people are living longer with the success of ARV treatment rollout, we can expect more and more cases of cervical cancer happening. And let's face it, this is an issue that's driven by inequality, and specifically by gender inequality. So the Global Fund, recognizing these different trends, our board adopted 2 years ago a policy in co-infections and comorbidities, which provides a framework for the inclusion in Global Fund concept notes for cost-effective interventions, including for cervical cancer control, that are aligned with national policy guidelines. This approach is based on country ownership and impact, ensuring that Global Fund financing is catalytic to the broader effort, while remaining closely to our mandate of fighting the 3 diseases. In order to be successful, we really need the full partnership to work. So we have progressively strengthened our collaboration with the global cervical cancer efforts, and strengthened our relationship with key partners like Pink Ribbon, Red Ribbon, Gavi, UNAIDS, UNFPA and UNICEF. And in addition, the Global Fund is working closely with WHO to support targeted work in the area of adolescent girls and young women around integrated sexual and reproductive health and HIV service delivery. Since the adoption of the policy, we've been funding integrated HPV/HIV programs in a number of countries in Eastern and Southern Africa, including Kenya, Rwanda, Tanzania, Malawi, and Zambia. But most of these are still at quite a limited scale, and we think we can do more and we must do more. But in order to achieve that, we really have to mobilize the full partnership, and we call upon all partners in this room to work together to increase awareness, to build the advocacy movement, and for technical partners to support countries in providing guidance on how to include cervical cancer in HIV programs. Please count on us for your collaborative action. Thank you.
Thank you so much for that commitment.